arteries, metatarsal arteries, and veins. The arteries will be red, the veins will be this kind of grayish blue, whatever it is. And these are your plantar arches, right? I can't tell what's on top and what's on the bottom. This is your tibial artery. It looks like your anterior tibial artery. You also have a posterior tibial artery. This is your anterior, posterior tibial artery. This vein that starts right here and goes all the way up is known as your great saphenous vein. This is the one you can cut and use for bypass surgery. Right? All these blood vessels here form an anastomosis that's known as the popliteal, or you can just call it the popliteal artery right here. This is the femoral artery. This is the deep femoral artery, deep femoral vein. Right? This is the inguinal vein, inguinal artery. Goes to the inguinal lymph nodes. Right? This is your external iliac artery, external iliac vein. When it ends right here, this is when the femoral would begin, or in this case, this is the great saphenous, but you can see coming in is the femoral vein and the deep femoral vein. So, but they don't show them. Well, this is the deep femoral here, I guess. This is the caudal artery. Goes to the tail, or to the, what you would call the coccyx, right? This is the internal iliac artery, internal iliac vein, external iliac vein, external iliac artery, common iliac artery. I don't worry about left or right. Common iliac vein, inferior vena cava, abdominal aorta, renal artery, renal vein, splenic artery, splenic vein, hepatic artery, or hepatic portal artery, hepatic portal vein, and then the heart, right? So when you're tracing a blood vessel, or a blood cell, you can come sit here and follow it up. Of course, the heart you already know. This would be the pulmonary semilunar valve, aortic arch. This is your brachiocephalic artery. This is your right common carotid. This is your right subclavian artery. Comes down here. This is your right axillary artery, your right brachial artery, your antecubital artery, your right ulnar artery, your right radial artery, your right medial artery, palmar arch, metacarpal arteries, digital arteries, and of course the veins have basically the same name. Here's your ulnar vein. Here's your radial vein. Now this vein going up on this side is called your cephalic vein. Like the saphenous, you can cut it. It's a third vein, right? Of course, your pulmonary, these things are switched. This is the pulmonary artery, pulmonary vein, got those. Here's your left common carotid. This is your left external carotid going up. There's one going in, which you can't see, is the left internal carotid. And this is the left subclavian. You've got cervicals here, we're not going to worry about those. Left brachial, left axillary, left brachial. Here's your antecubitals, and then of course your arm's twisted, so it gets all screwed up. But this would be your dorsal palmar arch, metacarpals, arteries, and of course your digital arteries. Got all those? Not too bad.